I'm Keith Dyke. I'm in Southampton. It's a community along with Port Elgin that makes up the municipality of Saugeen Shores. We have about 13,000 full-time residents. In the summertime, it probably triples in size. In terms of the community itself, it's made up of a lot of people who have post-secondary degrees. It's a fairly high-income area, but we also have a diverse population that includes engineers, educated people, farmers, other professionals as well. So there is some farmland component to it, as well as the Bruce Nuclear Power Station. The community has fairly good amenities in terms of restaurants. We have Walmart, Canadian Tire, all the usual thing, fast food joints, but we also have great recreational facilities in terms of gyms that a lot of residents use. In the summertime, we have the beaches, swimming in the lake, lots of fun sea-doing and those types of things. And in the wintertime, there's lots of winter sports as well, including cross-country, downhill skiing. My practice is made up of a broad variety of patients, sort of all the age groups. I have lots of kids as well. I don't do nursing home visits, and I don't do obstetric deliveries, and nobody in the community does obstetrical deliveries unless they come into the emergency department. The clinic is directly across from the hospital, and it's about maybe a 5-minute walk from where the residents stay. So if you don't have a car, that's not a big deal. It's always nice to drive around. The residents have their own office at the clinic. They see their own patients independently. We typically review the patients then either at lunchtime or at the end of the day. Residents come and ask questions during the day as well, so it's not a big deal. Typical patient load in the run of a day can range anywhere from 15 to 20-ish, depending on the time of year and what the demand is for patients to be seen. And they'll do everything from prenatal checks, so post-delivery well baby checks, physicals, all sorts of things, lots of immunizations and stuff. I have a nurse at the clinic as well. She does most of our well woman checks in terms of pap smears and things along those lines, but there's lots of opportunity to do it if a resident needs that experience. In terms of other things at the clinic, I do most all lumps and bumps myself. We do it here at the hospital, so there's lots of opportunity for residents to do extra procedures and things as well. Inpatient care at the hospital, we have about 16 inpatient beds. We see both acute and chronic care. Patients get admitted usually from the emergency department. Residents, my expectation is that they would act as the MRP for the patients while they're here, and certainly that I assist them in any way that they need or that I feel they might need, and that usually works out fairly well. Typical inpatient load ranges from 0 up to about 5-6 at the most at a time, and again that varies throughout the year. I also do emergency work, which I'm doing today. I typically do about 4 shifts per month. If someone has a great interest in Emerge, my wife, who's also a physician, does about 4 shifts, so we can increase that amount. I do coroner work, so periodically we'll get a coroner's case. I had one yesterday. And also do occupational medicine at Bruce Power. If somebody has interest in palliative care, long-term care, which we don't get a lot of, then that can be arranged as well. Or someone who's interested in doing work on the local reserve here in terms of First Nations health, that can be arranged. In the hospital we have a GP anesthetist as well, so if anyone has an interest in anesthesia, or if they want to do Emerge and they just need more practice in airways, those types of things, they can get some exposure. Just down the road, about a half hour down the road, our referral center is Owen Sound. We have the full range of specialties that you need. Again, if there's something deficient that they haven't gotten out of their program so far, we can arrange extra training in that. In terms of call, we're only on call really when we're doing Emerge work. About 1 week in every 5. The living accommodations that we have are great. It's a 3-bedroom, 3-bath condo. Each resident has their own floor in terms of living space, in terms of their bedroom, bathroom.